White petrolatum-zinc paste is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It works by forming an oily layer on the top of the skin that traps water in the skin. This medication helps soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation from wetness. It also helps the dead skin cells fall off, keeps the skin hydrated, and leaves the skin feeling smoother and softer. It is recommended to use this paste as directed by your doctor, usually applied to the affected area as needed. It's best to apply it after bathing or showering and at bedtime for the best results. When using white petrolatum-zinc paste, it's important to follow the directions on the product package. Some products may need to be shaken before use, so be sure to check the label. Apply the paste to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the paste every time you wash your hands. If using the paste to treat diaper rash, make sure to clean the diaper area well before applying the product. It's also important to allow the area to dry before application. If using the paste to treat radiation skin burns, check with radiation personnel to see if it can be applied before radiation therapy. Remember to only apply the paste to the skin and avoid sensitive areas like your eyes, inside your mouth/nose, and the vaginal/groin area unless directed otherwise. Be sure to consult your doctor or pharmacist for more details. Using the medication regularly will provide the most benefit. Apply the product after bathing or showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the product. If your condition persists or worsens, seek medical help immediately. When using this medication, you may experience burning, stinging, redness, or irritation. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. If your doctor has prescribed this medication, it means that they have determined the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects. Notify your doctor right away if you notice any unusual changes in the skin, such as turning white, soft, or soggy from too much wetness or signs of skin infection. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using this product, it's important to consult with your doctor or pharmacist if you have any allergies or if you have any skin cuts, infections, or sores. Some ingredients in the product may make you more sensitive to the sun, so it's important to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. If you have acne-prone skin, look for the word non-comedogenic on the label to ensure it won't worsen acne breakouts. Additionally, some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. Before undergoing surgery or dental procedures, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult with your doctor before using this product, especially if you are applying it to the breast area. When using white petrolatum-zinc paste, it's important to be aware of potential drug interactions that could impact how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using white petrolatum-zinc paste safely and effectively. Remember to consult with your healthcare provider to make sure this medication is right for you and to discuss any potential drug interactions. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical assistance by calling 911. Alternatively, reach out to a poison control center immediately for guidance. In the U.S., residents can contact their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember to keep this medication out of reach of children and pets to prevent accidental ingestion. When it comes to dry skin, there are a few things you can do to help prevent it. Try using lukewarm water instead of hot water when bathing, and consider taking baths or showers less frequently, like every 1 to 2 days. Keep your baths or showers short and think about using a humidifier if the air is really dry. There are many different types of emollient products out there, and some of them have added fragrance or other ingredients that might not agree with everyone. Emollients come in different forms, like oils, creams, lotions, or sprays. It's a good idea to talk to your doctor or pharmacist to find the product that's best for you. If you forget to use this product on your regular schedule, just use it as soon as you remember. But do not use more product or use it more often than directed to make up for the missed dose. Make sure to check the storage instructions on the package and ask your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, as it is under pressure. Do not puncture or burn the canister. Do not dispose of medications in the toilet or drain unless directed to do so. Properly discard this product when it expires or is no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.